Guam, proud to be a Guamanian. 825. Let's go ahead and go to the KUM News Zoom room where Lieutenant Governor Josh Tenorio is standing by for a standing Tuesday appearance on the link. Good morning, LT.
Hey, good morning. How are you guys doing? And happy birthday, Mr. Tidegui. 92. Hey. Wow.
Yeah, that's definitely something to strive for.
That's the Inarahan blood.
Yeah, it is, right? Something in the water down there. 826. LT, so, we had heard from the Chief Public Health Officer in the last hour talking about the gradual decrease in numbers and also that there may be a decision to reopen more businesses based on that data. What can you tell us about that?
Well, we're looking at it every day. I know the governor's been talking about moving into areas that have already demonstrated their ability to practice some social distancing and doing so inside their businesses and facilities. So, I know that we've been talking about churches and I think the idea is when we open and we're opening at reduced occupancy, and as we continue to make progress and we raise the occupancy, I hope, or my hope is that if and when, I guess, we do get spikes in the future, that we could, instead of moving to full closures, use the reduction in occupancy to try and mitigate. Because I think, we're living in a situation where really at this point we're trying to do a good job containing the situation here and making sure that public health can respond fast. And that's the other thing that we're really looking at and trying to track is looking at the performance metric of public health, how fast it's taking them not only to do their contact tracing, but to make sure that all the folks that are in quarantine are under proper surveillance, and that there are moving parts that we're basically managing and trying to reduce a situation or the occurrence that this thing will spiral out of control, like it did in August. We're almost at 2,500 cases, and unfortunately, I imagine by the weekend we probably might hit there. Not to mention, the large amount of people that have died in the last few days, definitely in the last few weeks, but just in the last 24 hours, another 3. So those are all the things, in addition to making sure that the hospital is staffed and we can respond to whatever the future holds for us. And this is a big balancing act because we are isolated and, we're far from all the resources, but that's really the challenge I would think that we're looking at.
You mentioned churches. What about businesses like fitness centers? Because we've had a lot of them on over the past 2 weeks expressing their concerns and sharing their struggle during this shutdown.
That in particular is being really examined by the Physicians Advisory Group. And I did hear some of the gym owners who are trying to make amendments or adjust what their operations are. And I would say that I think in the horizon, near horizon, because exercise is very important, obviously. The more healthy people there are, the better the population will be in trying to deal with this illness or any other illness. But I would say that that's under the magnifying glass right now. It is in the horizon for sure. Right. And I probably, one of the things they're looking at is just the length, the space between people, when you're in a very strenuous place, the breathing. So that is being looked at, and it's being looked at by the physicians. And I would say that I could see that in the horizon. Is it going to happen by the end of the week? I'm not so sure yet. We'll know as we go on and see what kind of measures that we can take. It really is about trying to protect people. And, the other thing is the largest demographic that has the infection, and this, I guess, is the big problem for us. All the people in their 20s that got infected that are not sick. They have maybe they're asymptomatic or they have a mild illness. It is kind of like a false sense of security, and the spread is occurring in that area, and they don't want to, they don't mean to, but they're bringing it into their families and bringing it to the older people and the others that may not be so lucky and do get the symptoms. And that's one of the things I think that, when we do open these things, is to just try and get folks to bear in mind that although it may not be affecting them as much as they thought it would, but it does have capacity to hurt and sometimes kill others.
All right. So, how do you move forward and have these conversations about reopening when we have news like 3 people dying from the virus? I'm pretty sure it takes some careful treading.
Yes, it does. I mean, monitoring the levels and everybody that, the highest risk for the deaths are unfortunately those that are intubated and are on the ventilators. And those, we're just fortunate that we have, some good talent on Guam right now to help respond to the acute needs of the sickest people. And there are a bunch of people in there. It is very sad. And I mean, in the last week, there have been people around my age that passed away. And,
Right.
Despite them maybe having their own personal challenges, but it's still a life. And, some people are saying, well, but that's just a small percentage of the population. But, a life is a life, and we're already at 46.
Yeah, and it's not a small percentage of the population. I mean, Guam, even before COVID, we're a high-risk population. We have these comorbidities, and it's not just, 1% of it. I mean, in my family, it's over the majority that are living with these comorbidities.
Right. And sometimes it's genetic, diabetes is a big thing. And there's, they ask you when you go to the doctor, what's your family history?
How long you got, Doc? Right?
Huh?
When they ask me that, I'm like, how long you got, Doc? I mean, you got a couple hours? Because
and the prevalence in Native communities, Indigenous people have a lot of challenges in this day. And, our genetics weren't used to the fast food and the corned beef and all that kind of stuff that got heavily introduced after the war. So, it is, Native people are struggling. One of the populations that is pretty similar with us are the Navajo Nation in Arizona. They have about 170,000 tribal members, and they got hit so hard. But now they are doing such a good job, and primarily it's because their traditional leaders came in to talk to all the members, and there's a big compliance rate. And just like us, Chris, there's multi-generations in the household, which is the other risk factor for our island. In the Chamorro population and Filipino population and Micronesian population, we're used to taking care of our elderly, and we have sometimes 3 or 4 generations in the same household. That based on the spread is the real risk.
LT, it kind of sounds like you may have dropped the new posture moving forward when you talked about instead of open close, because that's kind of been a criticism that people have thrown out. You're now looking at sliding occupancy rates, right? So we're sitting in PCOR 1, and what I want to know is like baseline, right? Will we ever see another full lockdown like we saw during the first wave, or is this quote unquote the new normal where we're going to have PCOR 1, we're going to be locked down, people are going to be dying from the virus, but you can still go to get the tattoo or whatever? So I'm just basically saying, is this like the bottom, the bedrock of PCOR 1 moving forward, or are we still looking at closing places if we get a spread, or is it just going to be based on occupancy like you said?
Well, I think that's something that formally that's something being looked at. I wouldn't say it's approved yet, and that's because right now they're examining all the metric and cross-checking that with what our island has capacity to care for. So we are always, Chris, we're in a risk of that because of our isolation, our distance from the mainland, the shortage of medical professionals, in some cases our dependency for medical supplies and medicine from the states. And if those pipelines collapse or are delayed, then it could cause a bit more extraordinary response. To mitigate that, though, we're doing things to try and have stockpile, create capacity. And if we continue to do this to fortify us and basically buy us some time, and it's time for how can we best operate the island and operate the healthcare system with and for how long, and that's kind of like what we're focused in on, and then the manpower. That's the other side of it. And we have a lot of folks that are working on this. The National Guard, the Surgeon Cell in particular, has been working all these supply chains, both in human resource and in medical supplies and capacity. And I do want to say, Chris, a lot of this depends on the partnership with the local health providers. So the clinics out there, AMC, SDA, FHP, and all the smaller ones, plus all the facilities that could come online in case we have further spread and further hospitalization rates. I think that so the Surgery Center, all the other areas that have been unified under the cure, those are all going to help try and prevent us from heading into a direction of lockdown. But I would tell you right now, we just want to try and do everything we can to prevent us from having to go back down to that area. And when we did do that, it really was because a widespread community spread, and a lot of it caused by people who didn't know they had it that came in from off island. And based on our location, the high volume that we have people traversing, that's the other risk. So even people in the future with technology and with, I guess, progress in rapid testing, that's going to be another key area in trying to live this new normal. I also want to thank you and KOM, because the other part of it is early detection. And so the COVID alert, that the app that you folks helped and are helping us try and get people to sign on to, is another area. It really is going to be the time to respond and how we can get to the positives very fast, so they can isolate and then we can monitor their symptoms. That's really the key.
So it sounds like we are preparing for this time for a possible third surge, for whatever
well, gosh,
might
if
happen,
you
right?
Dr. Fauci the other day said we're not even in the second surge; we're still in the first surge. So I think that's the posture. We have to be ready, and with the situation increasing in the United States, with record admissions, record positives in some of the states, and the open travel to Guam, and our quarantine posture, that those all play a role in trying to mitigate and prevent further spread.
Mm-hmm. And what about come December, when federal funding, the PUA, it's no longer there? What are we doing in terms of planning and preparing? Looking forward to all the people that may be permanently employed come, I believe it's December.
Yeah, no, that's our big mission. So one of the other things is making sure that all of the spend that we have, infrastructure projects that autonomous agencies have, some of the military construction projects that pending, or even the base support systems, all of those, and making sure that our permitting groups, our permitting agencies, are doing their best to facilitate all of the private sector investment and all of the permitting that is required to not only protect the environment, but to enable further economic activity on the island. I think that's part of the focus, but really we have a long-term mission and a need to address the potential long-term unemployment issues. I'll say this though, that we do have a very resilient island, and we have faced so many natural disasters, even war, and it might not happen overnight, but I would just tell you that each time that we've successfully been able to deal with some kind of calamity, we've always thrived after that. And that's something that I would just say we need to get together, and it will require us working with the private sector and the other elected leadership to make sure that we don't miss any opportunities.
Okay. And just, I guess, your final message for everybody, and other things that you're working on, because you're working on a lot.
Yeah, so I just want to first, unfortunately, in the last week we had several more of our island residents that have passed away, and I just want to extend my sincerest condolences to them. I actually know some of the survivors this week, and I had a chance to speak to them. The governor has spoken to every single survivor of all of the people that have passed away. And I would tell you that they have talked about some of the needs that they have, and we're looking at ways, and I think shortly we'll be able to try and help those that are dealing with the loss, and sometimes with the burden and the expenses of burying them and moving on. It's a very terrible situation. So my first thing is to extend my condolences, and for everybody else to get the COVID Alert app downloaded. It is a way for us to try and return to some regularities in our life. And I think that as we continue to allow occupancy and openings and different things, especially coming in and trying to aid in the spiritual needs of our island, I think, get the app, wear the mask, try and follow all of the things that public health advises to do, and let's continue to be together. We do need to be united as much as possible to try and overcome this big challenge that we have.
Thanks, LT.
Thank you, LT.
Thank you very much.
All right, stay safe.
See you next week. That's there you go. 8:42. Lieutenant Governor Josh Tenorio. We'll take a quick break and come back and talk about ESGR. They usually have like a big function. Because I've hosted it a couple times. They pay good.